Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. First, let me introduce myself. My name is Rina Shifa in India. I'm from Medical School of Sultan Agung Islamic University. In this video, I'm going to talk about epidemiology study on the bird flu. This video may take around 15 minutes, and if you want to ask, feel free to comment on the comment box below, and I will answer it as soon as possible. Without any further ado, check it out. Okay, I've divided this presentation into three main parts. There are introduction, methods, and result. Lately, we all have familiar with the word of virus. But in this video, I'm not going to talk about coronavirus. In this video, I want to talk about avian influenza. How much do you know about avian influenza virus, or in Indonesia common name is flu burung? Okay, first of all, I'm going to explain about the avian influenza. Highly pathogenic avian influenza, or H5N1 virus, was first isolated and characterized in domestic goats in Guangdong Province, China in 1906. The outbreak has since been reported in domestic poultry, wild bird, and human in over 60 countries. H5N1 virus infection with high mortality were subsequently detected in China, Southeast Asia, West Asia, and most recently in Africa. However, between November 2014 and April 2015, total case of avian influenza was 165 cases, including 48 deaths were reported to the World Health Organization. Secondly, I will explain about the methods that used in this research. There are 5 methods such as search strategy and selection criteria, case definition, data variable and extraction, ethical approval, and rule of the funding source. First is search strategy and selection area. Human H5N1 case data were identified and compiled according to type. There is probable case and confirmed case. Data on all human H5N1 cases in mainland China were downloaded from Chinese Center for Disease Control and Prevention. And data in Vietnam and Azerbaijan country was downloaded from Vietnam National Institute of Hygiene and Epidemiology. Data on human H5N1 case also provided by World Health Organization that available sources including World Health Organization weekly epidemiological record and the flu tracker website. This is the PRISMA, that is Prever Reporting Item for systematic review and meta-analysis. This flowchart is using from selective data in avian influenza. Okay, next. 2 is ethical approval. The National Health and Family Planning Commission of China, the Ministry of Health of Vietnam, and the Ministry of Health Azerbaijan determined that to type the collection of data from human case of avian influenza virus infection was part of the public health investigation of an outbreak and was exempt from institutional review board assessment. And 2, all data supplied and analyzed in an anonymous format without access to personal identifying information. 3 is case definition. World Health Organization or WHO case definition was used is two types. First is confirmed case and 2 is probable case. Confirmed case was defined as a human case of influenza virus infection reported by World Health Organization and with laboratory confirmation. For example, a patient with defined clinical sign, epidemiological linkage, and laboratory confirmation by an influenza laboratory accepted by WHO, as specified in the World Health Organization case definition. And the second type is probable case. Probable case if they had exposure to other confirmed human case or to sick or dead poultry, or the H5N1 infection was confirmed by the country or local institution but not meeting World Health Organization criteria. Next, this is the data variable and extraction. All probable and confirmed cases with illness onset by April 2015 were included in the analyzed individual data. On case include age, sex, country, type of diagnosis, year, month, and day of onset, data of hospitalization, final outcome, date of outcome, and potential risk factor. And this is the table of the research. Next is role of funding source. Role of funding source, there is two roles. Two rules. There are the sponsor of the study had no role in study design, data collection, data analysis, data interpretation, writing of the report, or the decision to publish. And the second rule, the corresponding author had full access to all the data in the study and had final responsibility for the decision to submit for publication. The view expressed are those of the authors and don't necessarily represent the policy of the China or the institution with which the author are affiliated. Next is result. This is the geographic distribution of human case with H5N1 virus or avian influenza infection by outcome in May 1997 until April 2015. A total of 907 human H5N1 cases were reported globally during the 18-year period from May 1997 through April 2015, of which 94% were confirmed cases and 5% were probable cases. The total number of cases in 2014 until 2015 was greater than that of the 4 years from 2010 until 2013, with the high monthly number occurring in February 2015 when there were 55 cases in Egypt and 1 in China. Next, this is the epidemic curve of human cases with H5N1 virus infection by region. The first curve is the epidemic curve of H5N1 virus human case report globally. There is 884 cases in this world. And the second curve is the curve of study at East and Southeast Asia, include Indonesia with 187 cases, and Vietnam with 134 cases, Cambodia 58 cases, mainland China 52 cases, Thailand 27 cases, Hong Kong 23 cases, Laos 2 cases, and Myanmar 1 case. And the third curve is the North Africa case with 363 cases, include Egypt with 123 cases. And this is the diagram, the age distribution of human case with H5N1 virus infection by gender, geographic, region, and outcome, where is the study from May 1997 until April 2015. The first diagram is the age distribution of all cases by male and female. The second diagram is the age distribution of all cases by death and survive, and then the age distribution of survival by North Africa, East and Southeast Asia, and last is distribution of death case by North Africa, East and Southeast Asia. And this is the case fatality of risks. By location identified, there are Hong Kong with 31 risks, and then Indonesia with 84% risks, and then Turkey with 33%, mainland China with 61%, and Canada with 100%. Next is summary. Avian influenza virus have caused a large number of typically severe human infections since the first human case was reported in 1997. However, there is a lack of comprehensive epidemiological analysis of global human case of H5N1 virus from 1997 until 2015. Data on individual cases were collected from different sources using a systematic approach to describe the global epidemiology of 907 human H5N1 cases between May 1997 and April 2015. Overall, case fatality risk was 53%, which varied across geographical regions. And this is the reference that I take to making this presentation. And last, thank you very much for your attention. I'm sorry if there are any problem with my pronunciation or my material. Wassalamualaikum warahmatullahi wabarakatuh.